My name is Becky and I'm 35. I am a job recruiter for a staffing agency. I do not have health insurance and I have probably $50,000 in medical bills that I can't pay.
My name is Alicia E. I'm 36 years old. I do have some health issues. I'm borderline diabetic. I was on insulin when I was pregnant, which I could afford the medication then because I had family Medicaid. But then I was denied after having my kids 3 months later. I do want to get insurance, but I don't have enough money to even afford the affordable insurance. We work in my fast food 9-to-5 job right now. I do sometimes, while I'm at work, feel weak, knowing that it's because I'm borderline diabetic, but I know I can't get the medication. I can't even go see the right type of doctor.
And living without health insurance is like, I like to explain it as like living, like playing Russian roulette with your life, you know? Because I have to be really sick and like dying to go to the doctor because I can't afford it and I don't want to spend that money.
I have personally witnessed, I have personally seen the struggles that individuals are going through, particularly in rural areas. I've seen mothers crying over their sick children. I have seen children crying over their deceased parents because they were unable to access the care that they needed.
I've seen it. Imagine the preventable disease and death and the family stress would be avoided if we just did the right thing.
When we can provide coverage for the adults that are poor, most of them are the working poor, many of them are in our service industry, then they can come to work and be healthy enough to work and provide for their families.
If we truly are concerned about the livelihoods of every North Carolinian, Medicaid expansion is a must.
A veteran is the only one that has ever said, "I will die for every single one of y'all." A farmer is the only one that has ever said that I am willing to feed all of y'all. However, both of which are having problems with mental health.
The Centers for Disease Control and Prevention has a breakdown of suicide rates by profession, and farmers have the highest rates of suicide by more than 30%.
If the backbone and the belly filler of the nation is unable to work because they're sick or hurt or killing themselves, and there's actually a solution to it, then why the hell are we not offering that solution? It makes no sense.
If we expand Medicaid, there are significant dollars that will come to our state that we need.
The money that we're spending in taxes that go to the federal government is being used to support Medicaid in other states. And so all of our tax dollars in North Carolina are supporting the states that do accept Medicaid expansions.
And they are getting the benefit of North Carolina's dollars that we really need for our own people.
For politicians who are so conscious of how tax dollars are being spent, to get 90% covered by federal government and pass that up is just a terrible thing to do to people.
Back in 2008, I became an addict. This is after I had my son, and I was denied insurance. I knew that I had postpartum depression, but I couldn't afford to go to the doctor, to see a therapist, to get diagnosed, to get the right kind of medicine.
I lost my best friend to it. And because like where we're from, she had no insurance from the time she had left pregnancy Medicaid. She had no insurance. There's no help there. What happened? She got discouraged. The system failed her. You know what I mean? Now she's not here. She's got 4 kids. You know?
I feel like so many people give up, and that's why there's an opioid epidemic, because people are they're going to get help and they're getting turned away. And so when you want help, you can't get help.
Individuals know that they are suffering from addiction. They recognize and understand it's breaking up their family, and they need help. They want help. The challenge is capacity. We want to serve our patients who are suffering from opioid addiction. And again, Medicaid expansion can help make that happen.
I mean, if you have insurance, like, there's so many possibilities. It's up to you how you want to use it.
By investing in Medicaid expansion, the net result then becomes a tremendous savings to the healthcare costs that North Carolina currently pays. It would translate into improved health outcomes, lowers emergency department utilization, lowers length of stay in hospitals. It is a very minimal investment that would have a tremendous return over time.
Rural hospitals in North Carolina are really struggling. Some of them have already closed or threatened to go bankrupt. They don't have Medicaid expansion. It would help, because a lot of times in these small and mid-sized towns, the hospital is a major or the major employer. And if they close, then that's going to be a large loss of jobs for that economy.
The benefits of Medicaid expansion would be profound, not just for our health center, not for Commonwealth Health, but for health centers across the state, as well as communities across the state. We have over 7,000 patients that are currently uninsured that would convert to Medicaid if Medicaid expansion were to happen in North Carolina. 7,000 patients would add an additional $3 million to our bottom line. Those additional revenues that we earn, we turn those right around and they go back out into the community. And they go into the community through expanded programs like mobile dentistry, more medical providers, more dental providers. You have individuals moving into a community who are providing care, requires additional infrastructure. You construct a health center, you have new employees who are coming in, they want somewhere to shop, they want somewhere to live, the businesses follow, the opportunities increase. It's not just about health care, it's about the entire community.
What I would say to our representatives is care about your constituents. These are everyday people who are looking to you to do the right thing. And the right thing is to put politics aside and vote to expand coverage to the people who need it, because without it, they're dying. And they're sick unnecessarily so. This is the richest country in the world. We can do better. We can do better. We should do better.